We are glad you are here. This is our second dental specialties webinar. My name is Dr. Layla Haishaw. For those of you I haven't had the pleasure to meet, I am the proud founder of Diversity in Dentistry Mentorships. And this nonprofit is here to serve you, the dental student, to serve you, the pre-dental student, to serve you, the student who's exploring careers. And we want to share with you just how amazing the world of dentistry is. Dental specialties is so unique in that they are a way to hone in skills that are exciting to you. There's different ways that you're impacting patients and the communities, and we have a host of dental specialists here to share why they went into the field, what helped them get into the field, and how they can help you explore this exciting career path. So I am very excited. There's so much to talk about, so I will keep it short. Just welcome. We're so happy you're here. I want to thank my colleagues for taking time out of their Saturday morning away from their families to be here with us. As we always say it, we did it, so can you. There's no way I could do it alone in this nonprofit without them. So my heartfelt gratitude to all of you. I am so excited to introduce you to our moderators today. We have with us Dr. Janelle Anamalechi, board certified pediatric dentist and CEO of Children's Choice Pediatric Dentistry and Orthodontics. Did I get that right? And she also serves as our board member with Diversity in Dentistry Mentorships. We're also going to be our moderator will also join us from New Jersey, Dr. Darwin Hayes. He's an advisor on our advisory council of the board, and he also has done so much in mentorship. He's got his General Residency Training Institute that he's going to share a little bit more about. This is right in his vein to really help you ask the right questions, meet the right people. You know, with mentors, what we pride ourselves in is sharing our social capital, because of many of the students that we are serving don't have access to that, and that reduces their opportunities to succeed. And that is why Diversity in Dentistry Mentorships is here. So without further ado, I turn it over to Dr. Hayes and Dr. Anamalechi to introduce our panelists.
Thanks, Dr. Highshaw, and happy birthday. Quick shout out to Dr. Jonelle. Happy birthday. And welcome. We did it, and so can you. So can you, especially if you're here today listening and getting some information about how you can do it, potentially seeking the ability to become a specialist within our profession. So we have a lot to talk about. Just some housekeeping items. Please turn your cameras on. We want to see who we're talking to. All right. Also, when you have a question, there will be an opportunity to put those questions both either in the chat or you can come on screen. And if you do come on screen, we want you to ask your question in this format, which is give your name, whether you're a high school, college, or a dental student, whatever your status is, and you lead off with your question saying, my question is, and then give your question. And then we'll make sure that we get varied responses from the group. And keep in mind, today we have a big group. We have board certified specialists from orofacial pain, ortho, dental public health, pediatric dentistry, endo, oral maxillofacial surgery, prosthodontists. Did I leave anybody out? I don't think so. I think that's everybody. I forgot. I didn't forget. Dental anesthesia, yes, which is a specialty as well. So we're going to start off this way. We're going to have, the first question is going to be directed to all of our panelists. What we want you to do is to introduce yourself briefly and tell us why you chose orofacial pain, why you chose endo, why you chose pedo, why you chose etc. All right, so we're going to just start off from what I can see on my screen. Your screen may be a little bit different, but we're going to start off with Dr. Bergman, who's an orofacial pain specialist.
Hi, I'm Dr. Susie. I like to go by that. I'm very informal. I am an orofacial pain specialist. My story is really different probably from the rest of the panel in that orofacial pain chose me because when I was in college, I was involved in a really crazy accident that destroyed my jaw joints. And so that really changed the trajectory of my life and my career. I absolutely love what I do. I practice in Vancouver, Washington. And I'm also very involved in research, advocacy, and infrastructure besides clinical work.
Awesome. Thank you. Dr. Claiborne.
Good morning, everyone. My name is Dr. Barbara Clyburn. I'm a dental public health resident at UCSF. Why I chose dental public health, I actually previously thought I wanted to be an orthodontist. So shout out to the orthodontist here on the panel and those interested in it. Um, there's a program now called the CHPET program, the Summer Health Professions Educations Program, which is a pipeline enrichment program for college students who are interested in going to health professions. And it was through that program that, kind of similar to this, we were exposed to all of the specialties. Um, there was a lecture that happened during the 6 weeks that I was at UCLA because the program has sites all across the country. And I attended the UCLA site and heard a lecture on dental public health. And I realized that it was more up my alley. Dental public health really encompasses addressing oral health issues at a community-based level. So, how do we reach people who may never come to our dental chair or be in our offices? So, um, being that it's a good combination of things related to oral health, health equity, and social justice type of things, that definitely perked my ears a little bit and changed the rest of my life. So that's how I got into dental public health.
Dr. Roel.
Good morning, everyone. And as we say over here in Hawaii, aloha. My name is Dr. Dentonio Worrell. I am a board certified endodontist. I practice in the United States Army. I am a graduate of the first dental school in the world, the University of Maryland School of Dentistry. I'm joined by some of my classmates today, so I don't feel so outnumbered by the pediatric dentists on the panel. But I chose endodontics. It's actually a long story, probably too long to discuss here. Like Dr. Clyburn, I was actually interested in another specialty while in dental school. It was periodontics. I like the surgical aspect of periodontics. I didn't get a ton of exposure to endo when I was in dental school. However, fast forward a couple of years into practice, um, I will leave my email if anyone wants to get the entire story. But I had a divine moment in the middle of Iraq while deployed, and God showed me endodontics in some distinct ways. And I came back, and all the doors opened up smoothly, and I just followed the plan. And life hasn't been the same since. I really enjoy endodontics. And you probably saw the little joke on periapical. We consider ourselves periapical neurosurgeons, and I look forward to talking to you all about it more as the time permits.
Thank you. Dr. Natasha.
Good morning, everyone. My name is Natasha Furshgad. I'm an oral and maxillofacial surgeon, and my subspecialty is in pediatric left and craniofacial surgery. My background, I'm Hispanic. I was born and raised in Costa Rica. I did dental school there. And my dad is a dentist. I was a musician. I played for the National Symphony Orchestra. And he one day said, you have to, if you want to be a musician, that's fine and dandy. But if you're used to a certain lifestyle and you want to, be independent and the way I've raised you to be, you might want to choose a career that in Costa Rica might give you a little bit more financial security. And so I chose dentistry because, I knew what it was to be a dentist, at least seeing my dad do it. And when I was in dental school, I just didn't appreciate it as much as I thought I was going to until one day I was rotating through the hospital system, and I saw the repair of a cleft lip, and that sold it. I was like, this is what I want to do for the rest of my life. And so I decided that oral maxillofacial surgery was my niche, and there were no OMS training programs in Costa Rica. So I one thing led to another, and now I'm a graduate of the Ohio State University, and I went to the University of Pittsburgh for fellowship training. And fast forward another 10 years, I'm the president of our 9 OMS practice. We practice the full scope of our specialty, and I'm very happy and proud to inform you all that as of yesterday, it's official to announce that Texas has its new residency program based at Texas Tech in our location. We will be all 9 attending, servicing this really wonderful enterprise. So, yeah, it's a very special time in our lives, and there's been a lot of hard work dedicated to it. And I am the only Hispanic and female oral and maxillofacial surgeon in my practice. They've, honored me with giving me the managing partner position, but there's still too few of us. There's, underrepresentation of women in what I do, and I love what I do, and I wish I could join you all in and inspire some high school student or dental student to become one of us, because there's definitely a lack of representation of not only Hispanics in dentistry, us as minorities, and certainly females.
Thank you. Thank you. Yes, you are charged with making music in the mouth. That's what your charge is now, right? So thanks for that. Student Dr. Sydney.
Good morning, everyone. My name is Sydney Fields. I'm a fourth-year dental student at the Hunt School of Dental Medicine here in El Paso, Texas, Texas Tech, like Dr. Frischgott just mentioned. I just recently matched to dental anesthesiology residency, and what first interested me in anesthesia, originally, I guess, was kind of the science behind it, the pharmacology with some of the drugs. I was a chemistry major in college, so when we first learned about it, it was a little more interesting to me than some of the biology things we had learned in dental school. Like Dr. Clyburn, I was originally interested in orthodontics. But what I love about anesthesia is I love children, and a lot of dentist anesthesiologists work with pediatric dentists to provide care for children that otherwise might not be able to get the care that they need. And I really like that DAs work a lot with special needs patients. And before being introduced to the specialty, I didn't really realize how hard it was for special needs patients to get the care that they need. And through sedation and through the services that dentist anesthesiologists provide, they are able to be seen in a private practice setting much sooner than having to be on a hospital wait list for months and months at a time. And I love that that is something and a service that we can provide. So yeah, that's why I chose anesthesia, and I saw that there's 2 people here that are interested. So I love that. Anesthesia is great.
Awesome. Awesome. And so Dr. Samantha, tell us why you chose prosthodontics.
Morning, everyone. I'm Dr. Samantha Trung, and I'm currently in Austin, Texas. So there's a lot of people in Texas here this morning. I actually went to dental school with Dr. Worrell there, and after dental school finished, I went to USC and I did a general practice residency, just because I didn't feel like dental school had provided me enough experience. And then, so I did a 1-year hospital residency where we did like surgeries and stuff in the OR. We did in the clinic too. So it was like a really diverse experience there. And then after I finished that, I decided it still wasn't enough. So then I went to prosthodontics, which is another 3 years. So most people go into prosthodontics, I think, because they want to do all this full mouth rehab. I went into it a little bit different. I wanted to actually basically learn and understand why we do the things we do, why they taught us these techniques in dental school, because I feel like understanding that makes everything else so much easier. Like you know your why, and so when you go to do things, it's just simpler, I would say. And the other thing about prosthodontics, I think, is it makes you look at everything in a big picture. And so when you see a patient, you don't just see like one tooth, that's like the whole mouth and the longevity of it and what's going to work and what's not going to work. So I feel like if you want the whole picture, this is a great area to go into.
Thank you. Shout out to University of Maryland Dental School, first dental school on the planet. Um,
That's right.
thank you. Dr. Jonelle, birthday girl, birthday lady.
Hi, everyone. I'm Dr. Anna Malechi. I'm a board certified pediatric dentist. I'm that girl who's wanted to be a dentist since I was 5. Based on an experience with my own pediatric dentist, I went from one that wasn't so great to one that was amazing. And so, just as my mentor, who was my pediatric dentist, told me, I went to dental school with an open mind, and really actually fell in love with endodontics. And then circle back to pediatric dentistry. And then once in that path, knew that I wanted to make an impact and actually make some different changes, and I needed to learn how to do that. So got my master's in public health and maternal and child health, spent some time abroad learning about health and disease and how to approach them from different cultures and perspectives. Spent some time on the Hill with Representative Clyburn doing oral health policy, dental director, and then private practice. So if you have any questions about those types of things and sort of the interesting routes that you can take with dentistry, I'm here to answer all those.
Thank you. Yes, and they will have questions for you. Dr. Ivy, please introduce yourself and why you chose your specialty.
Hi, everyone. I'm Dr. Ivy Fua, and I grew up in Los Angeles. I actually grew up with very poor oral hygiene and like poor dental health, and I very much dislike going to the dentist. But I had the opportunity to have orthodontic treatment, and I had a a great orthodontist, so that's why I got interested in dentistry. I was a product of the public education, like elementary, middle, high school, and college. And first to go to college in my family. So took me a little, I had like a not a direct path to dentistry, to dental school, but once I um, was in dental school, I thought I wanted to do orthodontics also. And I just one thing led to another, and I found pediatric dentistry and just kind of felt more connection to pediatric dentistry, and yeah, that's how I became a pediatric dentist.
So thank you all for sharing those those inputs, and hopefully everyone can see that there's a trend here, right? Not only is there an ortho trend, right, but there's also a trend of stories that many of the panelists have shared related to it wasn't just one specialty that they were exploring. It may have been another one totally different from the one that they are actually in right now. So keep that in mind as you all are exploring different pathways to becoming a specialist within the actual I can't talk today, the discipline, tongue-tied discipline. So next question. We want to hear from the panelists related to what they like most about their specialty, right? One or two things, and then also identify some of the, one or two challenges that are incumbent when you are in that specialty as well. So what they like most and one or two challenges so that those that are listening and watching have a better idea as to, the full scope or 360 of that. So I'm just going to start back with Dr. Ivy, since you ended, or have you start off this time. What do you like most about pediatric dentistry, and what are some of the challenges that you have found over your career?
I think something I like the most is that, children are so innocent, and you can really shape their view on dentistry, and, with, just their first interaction. And I also love connecting with families and making friends in my own practice. It's amazing. I don't know if I'm supposed to do this, but I make friends with my patients and like real life friends, and I love that. Um, the challenges are, sometimes explaining like if a child has, like severe dental needs, like sometimes that's hard to for a parent to kind of understand that. And sometimes we have difficult parents. I think that might be the hardest thing is, dealing with not the child, it's mostly the parent. And also I'm a practice owner, so I'm a pediatric dentist, but also a business owner. So I love the pediatric dentistry aspect, but there's also the challenge of being a business owner, a boss, running your business. So those are kind of the challenges for me.
Sounds good. Continuing with pedo, Dr. Jonell, what are some of the things you
Um,
like most?
Similar to Dr. Ivy. So I'm a mom myself of two. And so I love the community and that we're able to form with our families and just kind of the education part of that. Shaping from the start is always much easier. Breaking habits before they even start is really huge. And I own three practices. So as Dr. Ivy said, the business ownership part is uh, challenging on time and on everything else. I am currently sitting in my daughter's gymnastics class and working on something else. So there are all the things that keep happening, but I don't want to say it's a deterrent. It's just a challenge, just like anything else that we do. So, but those are the things. Just continue to always juggle. I feel like I'm always on the clock, on someone's clock.
Gotcha. Prosthodontics, Dr. Samantha, what are some of the things you like the most and some things you have found challenging over the years?
Things I like the most in prosthodontics is my patients, I would say. I get a lot of geriatric patients, which I really love. Kind of like Dr. Ivy, I really bond with my patients, and they're really sweet. And things that happen in their life. That's actually the why I went to dentistry in the first place, was to build these relationships with people and with patients over time. They're more like our friends. They come in and we hear everything, and so that's my favorite part of the that aspect. The challenging thing about pros, I would say, is when other dentists say don't want to see the patients, they will say, oh, send them to the prosthodontist, or if it's a case that's too hard, send them to the prosthodontist. So a lot of times I get, challenging cases that come to me and they're like, oh, or if they come in, they go, oh, I'm looking for a prosthodontist. I'm like, how do you know this word? Because no one really knows what a prosthodontist is, right? And so if they come in and they say they're looking specifically, I'm like, okay, I know they've probably gone to multiple people. Someone has said something they can't do, or they don't like what they've heard as a recommendation. And so then they're coming to me. So that's probably the most challenging, but then it's also fun because then you get kind of creative and you go see like, oh, what's going on, like why is this? And sometimes I think it's just patient personality too. Most of the time it turns out to be. But I would say that's probably the most challenging, but also the most rewarding.
Gotcha. Now, student Dr. Sydney, you have a very different situation in that you haven't actually started to dive into dental anesthesia, but you will soon, right? So, what are some of the things about the discipline that attracted you in comparison to some of the other specialties? So, one of the things that you liked specifically about dental anesthesia for you, and then also what are some challenges, maybe some things that other dental anesthesiologists have shared with you, other residents have shared with you as well?
Yeah, so like I mentioned before, I think just like the opportunity to cater to critical populations like children who need dental work, and nitrous or oral sedation is not going to be enough for the pediatric dentist to do the work that they need. There are a lot of kids that I've seen with my mentor and on my externships in hospitals that need a lot of work to be done. And so just to be able to provide that care that those kids need to get them out of pain. And then also, like I mentioned, the special needs population. At school, I'm the community service chair for our disability inclusivity and dentistry organizations. We work a lot with the Autism Society of El Paso and other organizations in the town. And then I think just the immediate impact to be able to communicate well with my patient in times of stress and be able to put them in a comfortable environment. A lot of people have dental phobias, dental anxiety, especially kids. Like they come and they might be scared or not knowing what's going on. So immediately to be able to put them at ease and just sedate them so that they're in a comfortable and they have a positive and pleasant experience, I think is really satisfying. And then as far as challenges, the scope of practice for most DAs is mobile. So you're working in an outpatient setting and you're going into different pediatric dentist offices, doing the sedation and putting the patients to sleep. So when you're doing your training and residency, it's in a hospital setting. And should any emergency arise or anything happens at the snap of a finger, you can call, for a lot of help and have a lot of support immediately there to help you manage an emergency situation, should there be any problems or hiccups with the case. But when you're in the outpatient setting, typically you are the only person in that office that knows about sedation, knows about anesthesia, knows, emergencies or anything that's happening. So I think for some people that might be intimidating that, I'm in this dental office and an emergency comes up and the dentist or the dental assistants or the dental hygienist or whoever the case may be, like everybody's looking at you to manage the emergency in the situation. And that might be a lot of responsibility for some people. But you are trained well in residency to handle those emergencies and handle those situations. So you feel comfortable to safely provide sedation. Also, if the case is not like if it's an ASA 3 or 4 or a really sick kid, they're not a kid that you're going to see in a dental office. They would be in a hospital anyways. So you're really seeing healthy kids and like the risk of things happening is very, very low. But that still is, anything can happen at any time. Let me just say that. So I think that's a challenge. Just having all that responsibility and onus on you that, these parents are entrusting you or with their children or, just the patient in general. So that's a lot of responsibility that I anticipate being a challenge, but I think I'm up for the challenge and I can handle it. So.
Well, that's good. And also be up for the challenge of the other kids called adults. Adults need you too.
Yes, sir.
Right? Cool. So, Dr. Natasha, oral surgery, what are some of the things you like most about your specialty and some challenges that you've noticed?
I think about my specialty in general is the immediacy of results, right? I think that we all know the satisfaction of taking out a tooth and it's like, so I don't think that ever gets old or like when you break a jaw, like that feeling of the procedure itself, it's very satisfying and in a way that, isn't just, from the technique itself, it's, alleviating someone's pain almost immediately, draining a huge neck abscess, seeing how a cleft lip comes together and it's like, wow, I did that, right? Like we all did this in this room, anesthesia, the nursing staff. So I think a lot of it also, like my day in and day out, is the teamwork because I can't really do things by myself or on my own. And I think that, the strong relationships I have with my staff mostly and the immediacy of my procedures and things that, can become life-changing. Even if it's just taking out an infected wisdom tooth. So I really like the challenge because no one case is the same. And, as you develop your technique and become faster and become more efficient, like you see how much better your patients do and your outcomes ultimately are impacted by that. So I think that the surgical experience or the surgical techniques for patients as developed in the past decade of my practice, I can feel how that learning curve of the initial, patient management has really become less challenging for me at least. And then the parts that I don't like are, certainly difficult patients, but I think there's a common denominator here in us business owners that it's just the hassle of being the HR manager, practice manager, billing and coder person and all this extra stuff that is important for us to learn at some point. And if we are going to be business owners, because there's a lot of things that you can do wrong, right, to get in trouble. It's very expensive. It's a very expensive experiment, if you will. And I respect DSOs and that model and whatnot, but and for all of you that may not know what a DSO is, it's basically corporate dentistry, right? So it's a big venture capital group trying to incorporate within their investors a, a, and absorb different practices where they take over the management. And I think that there's a lot to say in that corporate dentistry or the absorption of dental practices into these models is reasonable for many people, but it also takes away some of the autonomy and the decision-making process that I have to serve my community and my patients. And so I think it's an easy way out of this challenge for me, or it would be a considerably easier way to go, in that all these administrative burdens can be released. But
Yep.
I also like the fact that I have control over what we do day in and day out, and we are responsible ultimately for those people that we help feed.
Yeah.
We are a practice of 55 employees, and it's really cool to be able to have this enterprise and help our community, not only through helping patients, but also through helping feed 50 other families in our community. So,
And that's key. That's key because that
yeah,
autonomy is key because it's your license or it's all the provider's license, which is a whole
correct.
nother discussion for another day.
Yeah.
So thanks for sharing that. In endo, Dr. Worrell, what's some of the things you like most? Give us two things you like most and one challenge.
Okay. So so there used to be an old song called Wind Beneath My Wings, which most of y'all are probably too young to know about. But the first line goes, "Don't you know that you're my hero?" And as an endodontist, I get to be my patient's savior, the wing beneath their wings. I get to save them. I get to get them out of pain immediately, and they get to save their teeth, And so that part I really love because they literally look around at the end of the appointment and they're like, wow, happens most of the time, not all the time. So, which leads to some of the challenges. The other thing that I do like a lot about our specialty is that we are always on the cutting edge of technology. We are getting better. Our procedures are becoming even more predictable. We're starting to be able to do things that we didn't even think were possible in the past. For instance, some situations now where, say, for instance, you've lost the first molar tooth, and we can take the second molar out and do an endo in our hands and then re-implant it back into the socket of the first molar. They're becoming more predictable, auto transplantation. We have new technology like gentle wave. We use microscopes, CBCT. Everything's just getting better and better. We're always excited about where endodontics is going. Challenges, though, are the gift and the curse. I would like to say that we're probably the most feared of all dentists. And, people generally do kind of fear the dentist. They fear us, especially specifically because of the term root canal. The American Association of Endodontists has done a lot of work trying to market and campaign. And, we have like marches usually save your tooth month. But there is a lot of negative stigma associated with root canals that we're constantly combating. Even, President Obama in 2015 in his presidential address actually made a joke about root canals, the bank bailouts being similar to root canals, so that's kind of things that we always have to constantly fight. But outside of that, it's great. Yeah. Thank you.
Awesome. Awesome. Dr. Barber, General Public Health, what are the things that you like most and some challenges?
Absolutely. So one of the things I like most is that dental public health is very much community focused. We are constantly thinking of how we can get more people in the dentist and what barriers exist that prevent them from getting there. So things like the social determinants of health, which are um, variables that impact a person's health based on where they live, sleep, eat, worship. So helping to facilitate removing those barriers so that we can see more people in a dental setting, But for those who can never get to us, our mindset is also focused on them. How do we get to them? Whether it's a school-based program, whether it's going into nursing homes. So I really like the out of box thinking by creating like projects or interventions that are reaching more people in a limited amount of time. I also like that you have the ability to work in a variety of different settings. There's dental public health specialists, for example, who work in government. So HRSA, the FDA, they're up there. You can work in a clinical setting if you would like. So just across just about every spectrum, you can find dental public health specialists because we are dually trained as dentists, but also as public health experts. Um, One of the challenges I would say, number one is not being well known amongst even the dental profession. I remember vividly when I got accepted into residency, I was talking to one of my faculty, and he's been practicing, for example, for at least a good 20 years, and he had no idea that this was even a specialty. And that's what I'm kind of experiencing across the board, which makes panels like this special because we're able to talk more about the specialty and what we do. And then, of course, grant funding. A lot of the work we do is dependent on grants. So that can sometimes tie hands if, funding isn't adequate or funding is not available. So that would be my answer.
And just to add to that, I think what's important to note about dental public health for those of you that are considering the specialties, you as a dental public health specialist or individual in the field, you are dentistry's biggest advocates for all of the licensed dentists across the planet. All right. This is the area of dentistry where a lot of the laws that impact or get originated that go into legislate into the legislative halls and into the Dental Practice Act of your state that you have a license. This is where this work is kind of centered on as well. So I just wanted to add that as well. All right, Dr. Susie, orofacial pain. Now this is not just pain in the tooth. This can be, all over the place, right, in the head and neck area. So let's talk about things you like about the specialty and some of the challenges as well.
Well, I absolutely love my patients. That has to be the first thing that I say. I've heard people say dentistry would be easy if it weren't for the patients, and they're difficult and they're no-shows and this and that. But for me, patients usually come to me after they have seen a lot of other people and they feel hopeless and they're very confused about why nobody seems to know what's going on with them. So what I love is the moment when we really just let ourselves have a conversation with a box of tissues. The patient, shares their story. There's usually some tears. Sometimes their family members are with them. And I tell them, I'm going to help you. So I give them some hope. We work together for a solution. Orofacial pain is like being a primary care dentist. It's not dentistry with a handpiece and dentistry with, some of the things that people really think of when they come to a dentist. We're taking a medical history. We're taking a very involved exam to look at what is going on with them from a neurological standpoint, from a musculoskeletal standpoint. And I would say the challenge is that this is a specialty that is very poorly understood, has very little research, even though things like temporomandibular disorders cost the country $4 billion per year, but TMD patients get, up until last year, they got 50 cents per patient per year in research dollar funding. So it's, the challenge is breaking down the barriers between medicine and dentistry, and also behavioral health. This is something that we need to do with a team of disciplines, including our medical counterparts, our social workers, so many different people. So I'm very involved in trying to help with interprofessional education and integration. And I'm hopeful that in the future, when patients have a problem that is affecting every aspect of their life, as it does when you can't eat, or you can't smile, you can't speak without pain, that they won't have to go to so many different people before they find relief.
Yeah, thank you for sharing that. And it's important to note for those that are listening and watching that this is a situation that Dr. Susie talked about that's very key for our profession, because unfortunately, dentistry has been operating separately from medicine. All right, separately. Even though if you look at a person's tooth or a person's mouth, it's part of their head, right? And their head is attached where? To the body. So it's all connected. Unfortunately, our colleagues in medicine don't necessarily know a lot about what we do and how there's connections, which is a whole nother discussion. Maybe that'll be another discussion for us to have at a later date. But that's key. That is key. Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. Next is key is understanding what you should be doing as a future candidate or someone who is aspiring to become a specialist, whether it's in orofacial pain, endo, oral surgery, pros, anesthesia, pedo, etc. So let's talk about that. What are 3 things that the mentees that are listening and watching right now, up to 3 things, just give us up to 3 things that they should do, that they must do right now as part of their exploration into specialty for oral surgery or for endo or for dental public health. What are 3 things that they must do right now as they are pursuing this specialty and maybe even getting ready to apply as well? So, Dr. Susie, we're going to go to you with regards to orofacial pain specialty. What are some of the things what are up to 3 things that they should be doing right now to getting ready to get into it?
First thing is find a mentor within the field of orofacial pain. You need to learn what it is and how someone is treating orofacial pain in their practice. The second thing you need to do is look at the residency programs that are available, because there are only 12 schools in the country that are offering orofacial pain residencies. This residency or specialty has only been recognized since 2020. So it's our newest dental specialty. And then the third thing I would say is remember that health is dental health, behavioral health, psychological health. It's not just the health of our teeth and gums. And for orofacial pain, we really have to think about the whole person in a holistic approach.
Thank you. Dental public health. 3 things that candidates should consider in getting ready for or considering the specialty.
Absolutely. So, echoing Dr. Susie, I recommend finding a mentor. Mentorship is super valuable. So, seeking out a mentor, whether it be LinkedIn or our association is called the American Association of Public Health Dentistry. That's the Dental Public Health Association. So, even just having access to, or rather seeking out mentorship there will be valuable. It's also important to know that to become a board certified dental public health specialist, you have to have a master's of public health and a dental degree, so a DMD, a DDS, and then if you're from an international dentist, you can, as long as it's a CODA accredited program, that can be accepted as well. And so really thinking about the order in which you want to do things in. For example, I actually did my MPH prior to dental school. And so now, because the MPH is done, there are 1 year and 2 year program tracks. So if you have your MPH already, you can pursue a 1 year program. If you don't have your MPH, you can pursue a 2 year program after dental school to obtain your MPH and the residency specialization. So thinking about the order in which you want to do things. I didn't have a straight path into dentistry. In fact, I was a reapplicant. So I used that kind of gap year while I was doing the MPH. I'm sorry, the gap year to pursue the MPH rather. I think also important to know that there are about 16 programs across the country that are board certified or accredited rather in dental public health, and some have funding and some do not. My greatest recommendation would be to look into the schools that are funded. There are about 4 or 5 that are funded by HRSA, and for those programs, HRSA is the Health Resources and Services Administration. They provide a lot of grants not only to community-based clinics across the country, but also training programs. So, for example, my program at UCSF is grant funded, so it's tuition free and comes with a stipend. So that would be my advice also actually across all the specialties. Go where the support is, meaning go where the money is, as that's less debt that you would have to go into. So those are my pieces of advice.
Endo, periapical neurosurgeons. What should the future periapical neurosurgeons know about things that they should do right now if they're thinking about endo? What are 3 things?
So, sorry, apologize. So caveat, I'm in the military, so I did residency in the military. But I think some of the same things apply. I think first you need to shadow other endodontists, or endodontic residencies, endodontic residents if you have a residency at your school. You can expose yourself as much information about the specialty as possible. You can go to AAE.org, and that's the Association of Endodontists website, and get information there. You can become an associate member too. You can even attend our meetings just to get exposure to the specialty. I think you also have to probably be in about the top 10% of your class in dental school, or do very well your 1 year residency, whether AEGD or GPR. But you have to do well to be competitive, because the specialty is pretty competitive. And then, as are all the specialties. But then I think another key component is really to start as soon as you really know or think you're heading in that direction, express your interest in the specialty everywhere. let everybody know that that's what you're interested in pursuing, because I think Dr. Hayes talked about it before. Your network is super important. And so just by expressing that you're interested, somebody may say, "Hey, well, I know this person," and then you make those connections, and that can help you later on in your pursuit of the specialty.
And everyone means not just other dentists, but faculty members at your school. If you're an undergrad looking to get into dentistry, connecting with people in the community that may know an endodontist or may know an oral surgeon or specialist, and letting them know as well. Good point. Dr. Natasha, oral surgery, three things candidates or potential candidates should do right now, must do right now.
Um, I'm going to echo what everyone else mostly has said, right? Have a mentor or understand what a day in the life of is, and not maybe just one day, a week or a month. I don't think I could get into dental school nowadays without having, all these volunteer hours and shadowing hours. And, I think it makes more sense now than ever before to have, a leg into people who know what's going on in that particular area of expertise, right? I think that, even us in OMS, there's only about 11,000 oral maxillofacial surgeons in the entire United States. We're a relatively small specialty, and the ways in which we practice are all very different in different settings. Academic settings are very different than private practice settings, than those in corporate dentistry, et cetera. So I think that if you are already in dental school and you shadow an oral maxillofacial surgeon within your academic center, I think that's a very different reality to those that practice outside in private practice. And so look for people that are outside of your own sphere as well, and get to know those people and understand how it is that life is. This is not for everyone. The hours can be long. I may have not been able to come home before 9 p.m. every single day this week, and I had to work while sick. And this may not be for everyone's lifestyle, but I love what I do, and I think that it's important to have an idea of what different areas look like, or in different corporate, academic, or private practice backgrounds as well.
So real quick, Dr. Natasha, there's an exam for the oral surgery candidates who are considering going into residency. There's an exam. There's a very important exam.
CBSE.
CBSE. Real quick, 10 seconds. When should they take that exam, or when should they consider taking it? Because that is a very important step in the pathway to oral surgery.
Yeah, and this is a relatively recent thing. I mean, when I went to residency, or when I was applying to residency, I had to be graded on part 1 and part 2 of the NBDEs, and so that went away. Grading systems went away, and I think that really is in the detriment of people that want to get into oral maxillofacial surgery, because now the CBSE is basically like taking your part 1 of the medical board exam. And so you should take it hopefully right after or within your 3rd year. If you are thinking of exploring oral maxillofacial surgery, it has a lot of medical components, and it's basically a good idea of whether or not you are to pass the USMLE Part 1 exam. And that's what most 6-year programs are looking for, right? That you can actually become a medical student and pass their first exam, at least at a bare minimum. But I don't think it's necessarily a fair system, but it's the only objective way of, allowing you to grade people when the applications come about. And again, you should take it during your third year and get a good grade.
Yeah, you
Anything
definitely need a good grade. And the only reason why I bring this up because it can be missed. It can be missed. Taking that exam and preparing and when to take it can be missed in the process of everyday life as a D1, D2, and D3 dental student. So thanks for sharing that. Student Dr. Sydney, 3 things expiring DAs need to do right now, like you did, to get to dental anesthesia.
My first recommendation would be to shadow and find a dentist anesthesiologist to really understand the field and what they actually do. Because when I was applying and I talked to a program director and I asked him what he was looking for in an applicant, he said he wants someone that is willing to give up dentistry and be a dentist anesthesiologist because you are no longer doing dentistry anymore and you're entering the field of medicine. So to shadow and really understand that and what they do, ASDA is the American Society of Dentist Anesthesiologists. So if you go to asda.org, you can put in your location and it'll tell you the board certified dentist anesthesiologist in your area. So you can connect with them and shadow to find someone so you can really understand and get an idea of, like I said, what the field is, because it's not really dentistry. You work in a dental setting, but you're not doing the dentistry. So I think that's really important to understand that. My second recommendation is the CBSC. That is one of the most important parts of your application. Like Dr. Frischkott mentioned, like a lot of things are changing to where it's not a graded system. So that's the only way for the program directors to evaluate the candidates, to see on academic level if you are qualified essentially to be able to do that. The CBSC is only offered twice a year. It's only offered in February and July. So that's something to note because it's not like the DAT, which is the dental admission exam that you can just sign up at any time to take it. It's only offered on those days. You can register through the AOOMS. I might have the acronym wrong, but if you register through the American Society of Oral Surgeons, there's only one date in February and July that you can take the exam. If you register through ASDA, which is the American Society of Dentist Anesthesiologists, they give you a 2-week window in February and July that you can schedule the date. I don't think it really matters who you register with as long as you take the exam during one of those times to get the score. And obviously I registered with ASDA, so I had a 2-week window, which was a little bit more flexibility to schedule. And I recommend studying as early as you can to give yourself the best chance to score well. Like Dr. Frischkott mentioned, it's essentially the first 2 years of medical school. What medical students learn is what's on that test. So I had to teach myself 2 years of medical school in order to take the entrance exam to get the job that I have at the hospital that I'll be going to. And as a dental student, that can be a very daunting task because we do learn cardiology, neurology, pulmonology, but not to the extent that medical students learn it. So giving yourself the earliest chance to start studying that content, because medical school is very different than dental school, and I will leave it at that. But I think those are my 2 biggest recommendations: to shadow and really understand what you're getting yourself into, if this is what you want to do, and start studying for the CBSE as early as you can.
As early as possible. First, second year dental school. Absolutely. We're going to continue with Pros and Pedo next. For those that have questions in the chat, that ask questions in the chat, please look at the chat right now. There's some answers there, and then we will pivot to some more questions in the chat that have not been answered as well. Dr. Samantha, Pros, what should Pros candidates do? What are 2 or 3 things they should do right now as they're pursuing the specialty?
I think for pros, what they need to make sure is that they really like working with their hands. Obviously, most people do if you're going into dentistry, but I mean really working with your hands, because when you go into pros, the program's pretty intense. You're doing didactics, but then I also spent I'm at the lab till like midnight sometime processing my cases, setting my teeth, doing
only midnight. Oh, that's early. Only midnight.
Is it? Every day, and then you have to wake up and you have to go into doing your lit reviews in the morning at like 6:30 a.m. So it's a lot. So didactically it's a lot, but then also with the hand stuff. So you get to know your co-residents a lot. And So I would say check the programs because some programs you get a stipend and you get paid, whereas other programs you have to pay them. So like when I was in residency, I was lucky because I was part of the VA hospital, so I got a stipend. But other people in that same field in at like USC, they were paying like $60,000, $70,000 a year to do the PROS program. So make sure you check all the programs, and they only take like 1 to 3 residents a year. So it's, just like all specialties, it's a very small number gets accepted. And the other thing I'd say is have a really good mentor. Even go outside, go into private practice, call them and see if you can shadow them and see how their work is. Because I'd say each pros office they work a little bit differently depending on what the prosthodontist. Sometimes they just go into a really small niche of prosthodontics, and that's what they're doing on the daily. So that's something to go out there and to get to know about. Maybe shadow a couple offices so you get different viewpoints. And the other thing I would say is when you're in school, I would say, do your best, of course, get to know your attendings, your instructors and stuff, because you don't know later down the line, like 5, 6 years out, they're the ones who are going to be talking to each other and get you into the program, which is kind of what happened with me. My director at the PROS program I applied to, um, he actually called his best friend who was an instructor at Maryland and talked about me before I even came in. So he already had all the background information on me before I even met him. And I didn't know that. So it's like, I think kind of like in the background, be a good person too, be studious. And those are the things that are going to make you stand out. Just don't be like I don't know, because you never know who's going to have your corner, right? And so it's like, yeah, karma comes around.
Yeah,
So,
all hands on deck. Everybody helping you with that application,
yeah, yeah.
literally. Pedo. So Dr. Ivy, Dr. Jonelle, please turn your mics on. I'm gonna have both of you answer this question at the same time for Pedo, since y'all double teamed us today. Pedo.
I had three things, and one was just hit on. It's you getting to the level of it's definitely who you know. Also, your grades matter, and the people that you know matter. So what you've done. So shadow for pedo especially, you need to see it. Kids are cute, but not all the time. So you need to see it. And then for those that are pre-dental, I feel like the pre-dental program that I did at Baylor, my 3rd year summer dental school, changed my trajectory for getting into dental school. When I left that program, people were talking about me instead of me. Like I felt like I don't know. I felt like I was having a so chance of getting into my next level of of pediatric residency. So those programs for those that are in dental school going to the next level, then externships are available, and see what externships in your residency program are. And when you get to those, either pre-dental students or those that are now dental school getting ready to go into residency, when you get to those programs, please engage, step off your phones, step off everything else that's going on in life, and focus on
Yep.
this point that you're trying to achieve in your next life. Because
Yep.
those are also getting into those programs can also be ones that actually hinder you from getting to that next step, depending on how you conducted yourself in that step.
Just quickly, I want to echo everything that has been said, but making sure you're becoming involved in leadership in programs on campus, whether you're in undergrad or already in dental school, and making sure you're getting to know your professors because they're the ones that are going to be writing letters of recommendations for you. So really have to nurture those relationships and not just expect them to write a good letter for you.
Awesome. Those are great. So some common themes we've heard today, especially related to uh, aspiring candidates into specialty. We heard shadowing, right? Very important. With that is networking as well. If you don't know somebody in the specialty, that's going to be your first and primary job. You need to find somebody quick, not now, but right now. And then also we heard mentors, right? That person that you could potentially shadow could also be a mentor who also writes a letter of recommendation for you. See the connection? So now we're going to connect to what our mentors have said in the chat. There's some questions in the chat. Luma, you want to look at those and just
Sure.
tease out the ones that we might want to answer right now with the time that we have, and
Sure.
then We also have some time for some open questions that maybe people haven't written in the chat that they may want to get on and ask as well.
Sure. I think the main one, the one that has been reoccurring, has been about the dental public health. If there is like an admission exam, or what do you do when you're thinking of applying?
Great question. So I just dropped a link specifically to the AAPHD, which is our, as I said, our Association for Dental Public Health. That list is a really good one because it lists all of the programs,
Mhm.
their contact information is for their directors, and also the application deadline. My advice would be to just visit those websites to see what the requirements are because some schools require a GRE, some don't. And then like depending on the program you choose, some include the MPH, some don't. So it's really like specific to the program. So I would just spend some time on that website. And it was also asked how to be a competitive applicant. Dental public health has kind of as Dr. Hayes said, there's a research component, there's a policy component, there's an advocacy component because again, we're dually trained, right? So there's a lot of competencies that we're tasked to master. So I would say any exposure you can get, research experience, for example, that you can get, even if it's as like a like assistant, any type of thing showing that you have some familiarity with research, community-based programs, whether that be volunteering at a community-based clinic, or I know even in some dental schools, like our school had a really robust like community-based dental education program. So just those things, because again, we're dually trained. So anything showing that you kind of wet your feet in advocacy, research, community-based participation and stuff like that will be advantageous.
Okay.
Sounds good. Luma,
Thank you
did you
so
see there's a question from future student Dr. Jada about,
Yes.
yeah, go ahead.
So, Jada, do you want to get off the mic and ask, or should I just read it for you?
Honestly, guys, I'm typing so much right now. I can go on and on with questions right now if you guys are willing to answer them.
Let's go. Let's go.
Okay,
This is for
great.
you.
And can you please
So,
turn on your
I'm a
video?
oh, okay. I look a little crazy right now because I was taking out my hair. My birthday's on Wednesday, y'all. So
Put
I'm
some,
trying to
put
put
a
this
hat on.
together.
Put a
You
hat
guys,
on and some sunglasses. You good?
okay. Hold on one second. Give me 2 seconds.
So while she gets to that, her first question was regarding during the introductions, a lot of our mentors they talk about going into dental school with their interest in ortho, and then they change to something else. Is it like it? Is it just because there was a better option, or was it? Is it something about ortho, or is it because there was a better option?
Ortho is the
I
black box, right? Like, like you're not gonna find out a lot of stuff about ortho at some schools. You're not gonna find
Yeah.
out a lot of stuff about ortho. They kind of keep it a secret.
Can I
Uh,
answer, can I jump in on this one?
Yes.
So one of the things that I noticed is that many of us said, I started with this, I did this. Just because you choose a path doesn't mean that you're limited to that path. And dentistry is everyone who learns dentistry in dental school should be able to practice within the scope of their abilities. So, for instance, I started out doing pediatric dentistry. I absolutely love kids because I loved pedo, I decided to learn ortho. I had already been out of school for several years, so I took a 2-year program that was open to general practitioners, not through the academic university system. After that, I became an orofacial pain specialist. So just because we start somewhere doesn't mean that is the same thing that we do for the rest of our lives. Like Michelle Obama says in her book, Becoming, we don't just say, when I grow up, I want to be XYZ. We get to continually evolve depending on where life and our direction takes us. So ortho is amazing. And like Dr. Hayes said, they try to keep it a big secret in dental school. But I learned through an amazing leader in ortho education company that gave me the confidence to treat orthodontic patients without cutting corners. So there are those opportunities available.
Really quickly, I just want to say part of the reason why I kind of shifted is because in among pediatric dentistry, there is a big orthodontic component that we learn in our residency program. So I'm kind of doing some like orthodontic treatment, like phase ones, and it's kind of combined in pediatric dentistry. In pediatric dentistry, I'm doing a lot of things. I'm doing procedures that are like almost sometimes what an endodontist would do for young children. I'm doing aesthetic things. I'm doing restorative dentistry. So it kind of encompasses a lot of different things.
Dr. Claiborne?
Yeah, I was just gonna add, I believe for many of us, I know for me, ortho was kind of like my gateway into dentistry when I had braces. So it's like for many students, I know it's the first time we're kind of really exposed to dental options outside of a general dentist because many children associate dentistry with pain. So being able to see that, oh, there's other things you can do. That's why, at least for me, ortho was my first choice at that time because that's what I knew. And helped me realize I actually liked teeth. So that would be my answer, why ortho was the initial first stop.
Thank you so much.
So, yeah, I'd like to echo the same things, Dr. Clyburn. Yeah, it was just a matter of initial exposure to orthodontists, or seeing other kids that had braces and like, oh, what's that, but then once getting into dentistry, having my divine moment, but then also just seeing to just observing, like for me as an ortho, what orthodontists do, the volume of patients that they see on a daily basis, that wasn't for me, because there's pros and cons, to everything. So I just want to make one other point because I don't know if we're going to have time to do that, but like I think a key component of everything too is really to know yourself, like really do some introspection, know what you know who you are, and then think about the life and the lifestyle that you want in the future and factor all that out. And this is outside of dentistry. And then factor all that into your decision making in the process of which specialty you consider. Because, there's a whole life outside of your job, your profession, your calling, everybody's got, a family, kids, and there's other things that you want to do outside of all that. You need to factor all that in, because you hear a lot about work-life balance and all that, your decision on what specialty you do impacts that as well. So all those things I encourage you all to really think about and really try to know yourself and what you like and factor that into your decision making. Don't get just completely tunnel vision on dentistry and the profession. Think about your entire life.
Could I piggyback off of that? So that makes a good point. So I've been wanting to be an orthodontist since the seventh grade, and I've been pretty steady set on doing this my entire life. Like in my books, like if I've never had braces in my life, but if I knew that you had braces or if I see with braces, it always just sets you like up in my life. And for me, it's more of a like I really want to instill the confidence into somebody because like your face is the first thing that somebody sees, and I love to smile. Like I'm a big smiler, right? So it's just like to be able to instill that confidence in somebody else is just a huge factor for me, right? Now, with the other specialties, with being an orthodontist, since I'm like head set on this, and I know in the beginning you guys, or not in the beginning, throughout this, you guys made mention of when you know a specialty that you want to spread the word, like let them know, like, okay, that you want to become an orthodontist. So is it good to keep your options open until like I guess not go into it knowing, okay, or knowing that you could possibly change it. Like even here in college, like some people don't have undeclared majors, or at least knowing what you want to do. Or I've seen a lot of people come here and having to stay longer because they ended up changing it. So that was one thing that I was like very confident in, okay, because I've had a strong desire for orthodontistry for such a long time. So it's like I'm very set, so I know, okay, this is the goal that I'm accomplishing. But knowing that there's more specialties and may not be, or like the struggle of I guess how you guys were saying, like it being in a black box or nobody being able to, like, I guess, express that. Um, what do you guys think? I don't know if
Keep,
that was
keep,
too.
keep going. It's a process, future student Dr. Jada. It's a process, right? Yeah, you can have a plan B and a plan C, but if you spend the time on plan B and C, that means you're taking away from plan A, right? Yeah, right. So, and it's going to be very easy to look at and see what other people are doing. But yes, it's a process, and during the process, you're going to find some things that are going to be challenging about becoming an orthodontist. Now, it all depends on how bad you want to become an orthodontist. Is it as important to you as oxygen is to breathe? No one can answer that question but you. Yeah. And that will dictate how you progress through the process. Period.
No, that's a great point. Don't lose the prize. Don't lose your eyes in the prize. We're just saying you have to learn everything that's in dental school. Like you have to still learn it. So during that time you're learning, but you know where you're going, and that's okay.
Thank you all so much. In the interest of everyone's time, I will try to summarize the last few questions, because um, it's a Saturday and I don't want to take too much of everyone's time. So the last question is like it's from several people, but it kind of boils down to this. First, how do you make yourself a good applicant, like for residency, not just for dental school? Like, what are the steps that you should take? And then from Vincent, my classmate, he was directing this more towards Dr. Freshkopf. Like, what are your opinions on not getting in, and what, for example, for OMFS, taking that non-categorical year? So, what do you think should be done? And if you don't get in when you apply for what you want, what should your options be?
So I didn't get in my first try, and I got in on my second try. I did 2 years of a non-categorical internship. So you just keep trying. You just keep doing things that, I mean, doing OMFS was as important as breathing oxygen to me. And so I thought, well, this is devastating. How can they not consider me? Because I passed my first set of boards, but, back in 2007, when I first applied, that was still, graded. And so I was Spanish speaking only. I had finished my dental school. I had to study for my NBD Part 1 in a different language, and taking, studying for stuff that I had not read about in more than 5 years. So it was super challenging. And although I passed, it wasn't my best score at all. And of course, I wasn't considered for it. So yeah, I was graded on the score, even though I had done a grueling year of internship and I thought I deserved it. So let me tell you something. You're not given anything unless you meet those standards that they want you to meet. And unfortunately for many of us, that meant a second year of internship, a lot of tears, blood, sweat, but I had to get it done. And if it would have taken me another decade to do it, I probably would have still applied again and again and again until I got what I wanted out of life, because I wouldn't have been happy by my standards if I didn't get in. So non-categorical years, taking the exams as many times as you need to, maybe doing a different specialty first and then getting in on the sideway. I've had many colleagues do dental anesthesia first and then get into oral surgery, GPR, then get into oral surgery. If they've exhausted non-categorical internship years, go assist an oral surgeon, become a dental assistant, get into oral surgery that way. Even if you are already a trained dentist, right? There are many avenues to explore. So how important is it to you? You're the only one to determine that. And you don't have to put your life on hold to continue to become what you want to be. I've had oral surgeon residents be 45 years old and match, age is not a limit. The sky is the limit when this is what you have. And this applies to any goal in your life, right? If it's buying a house, buying a car, you have to put in the work. And it doesn't necessarily mean that for minorities it's harder. But I think that, the opportunity is up there for grabs for whoever wants it. And what was the other question? Sorry.
No, it was regarding how to make yourself a good applicant, and you already answered the one about what to do if you don't get in.
Don't portray yourself as pushy, right? Like too much energy might be deterrent to some people, but be very respectful and be very mindful of when you are shadowing, of when you are in someone else's environment, right? This is their work environment. This is their license. This is their baby. And when you are introducing yourself to other people, don't seem too eager to need to encompass all of their time, but still be present, be helpful, go in and show people around you that you are interested and that you want to have this be for yourself. Obviously, try to get the best grades that you possibly can. But I think that a lot of what we do in our specialty comes from word of mouth. From a pool of applicants, 200 applicants may come in any given year to a program. How do you set yourself apart from that? Well, it's that phone call that really important person makes to that other program director that sets you apart. And they're like, oh yeah, I'm going to pick that from the pool because they called me about this person. This person is special to them. It deserved a phone call from 1, 2, or 3 people, even if they're not immediately, known. A phone call is always very important. So be the person deserving of that phone call because you were present in their lives and they understood what good quality human and applicant you were. So I think that goes a long way in objectivity for some people's, in some people's minds.
Be determined, Vince. Be determined, not pushy. Be determined. Right?
Yes. 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 I feel like we need this session should have been 3 hours because we're coming up on an hour and a half. I see a lot of the mentors have already gone ahead and shared your contact information. However, I will let Dr. Hayes do his roundup, and then I will go on to diversity and dentistry stuff.
Awesome. Awesome. Well, I know this has been helpful just based on the response and everyone's engagement, blowing up the chat, people taking notes. Your fingers are probably tired from writing and typing. So that's good. That's good. And it's good that you all ask questions. Continue to ask questions even after today. Even if you heard something today, after today of us being online, write it down. Email us so that we can get those questions asked. I'm sorry, get those questions answered from the things that you ask. All right. And maybe there's a possibility to do a part 2 based on all of these other questions that we
Yes.
have as well. Because I got about 10 things I didn't even mention yet that I know y'all need to hear. And these are things that current residents and those that just matched have shared with me over the last 3 or 4 years. So hopefully that will happen. So Luma, what are we doing? We're doing final thoughts and then
Final thoughts.
announcements.
Yes.
All right. I'll start off with final thoughts and maybe everyone can, or the panelists can just share one more word of wisdom, or one thing that they would want to change, or just something, just final thoughts about what we've talked about today. I'll start off, which is, it is a process. It's not only a process called life, but it's a process related to you getting into dental school, getting into residency. It is a process. There's no such thing as a perfect process. It is a personal process. The things that you can learn from other people is key for your personal process. So that means you must be connected to other people that are on this call, people that are not on this call, people that you have connections to that you don't even know that can help you. Stay connected to people, and also know that if you get a no, it just means not right now. It's not over. It's part of the process as well. So, Dr. Barber, what are your final thoughts? And then we'll go around the room.
I would just say to keep an open mind. As again, my journey, like I said, I was just so fixated on ortho at first, and it was through a pipeline program that I found out about dental public health. So just keep your mind open as opportunities come your way. Be willing to say yes just for the exposure, because you never know what you're going to discover.
I'll share really quick. I guess my one piece of advice is with everything, like don't let everything that's going on with like the current administration like get to you, because there's a lot of things that, everything like DEI initiatives, all of the funding and all that, just don't let that get in your head. Admissions departments and the people who are on those committees know that there's like big disparities, and just try to meet your minimum requirements and do as much as you can to meet those requirements, and then do all the other extracurriculars, but you got to meet those minimum requirements. I guess that's my piece of advice.
Anyone else? Anyone else?
Yeah, my advice would be this is just a plug for diversity in dentistry. I didn't have anything like this when I was a dental student. I had one faculty member who believed in me and was the reason that I kept going in dental school, because I was a chronic pain patient and I was really not sure, was I going to continue on that path? So I just want to say, like, you had an awesome opportunity today to be at this webinar, and please don't keep it to yourselves. Share it with your friends who are interested in dental school or are already in dental school, because this program is here to help you succeed. Like Dr. Haisha always says, we did it, so can you.
You. Does anyone else have some final words?
Sure.
Yes,
Nobody's talked about books. So, yeah, nobody's talked about books. So, there's a great book out there. It's a bestseller or whatever. Seven Habits of Highly Effective People by Stephen Covey. One of the habits talks about begin with the end in mind, and that applies to anything you do in life. Think forward to the end results that you want, and then work backwards from there. Then just to go along with what Dr. Hayes said, a delay is not a denial. So it's all a process. So just keep working through. Best of luck to y'all. And lastly, have to give as well Dr. Haishaw her flowers, in creating this organization. It's there for y'all. Take advantage of it. We're here to help. Thanks.
Thank you. Thank you so much, Dr. Samantha.
I was going to say there's one thing none of us really mentioned here is the business aspect. Like, definitely that's something dental school does not go into that enough. And that's one thing maybe we need to change, or we need to go out and figure it out on our own to learn all of that beforehand. Because that definitely is, I feel like one thing is lacking, especially if you're in private practice. If you're not a DSO, you're going to have to learn how to do that yourself in order to be, a successful business person, in addition to being a successful clinician and everything. So I think that's really important.
Thank you so much. Dr. Freshkov. Oh, sorry.
I'll say the same thing about business. I think, I'm actually considering going and getting an MBA, because this is a bit much. You guys, I like to do things the right way. I want to know that I'm not getting in trouble, and we have a very large practice. I think that the business aspect of this is really important, and it's very rewarding also to understand the whole aspect of your practice. I think that we are people of science. We are people that believe in understanding what we do. We practice evidence-based medicine and dentistry. And so with that said, there's that one really good aspect of our practice that we excel at. And then there's a really other important part of our practices that I think is underdeveloped in many ways, and that it's a trial by ear. You go through your practice by trialing things, and you find out about things by mistake. And I feel like there's definitely a lot of room for us to focus on the business aspect of things and the legalities of what it is that we do, especially for us to take federal plans in our practices, and are subject to very grueling audits as well, potentially.
Thank you so much for that, student Dr. Field.
Yes, I just wanted to say that kudos to all of you guys for waking up on a Saturday morning to attend the panel. I think that shows a lot about your initiative and who you are as people. All of you are going to be successful. We all want you to succeed, and we're all here for you. My just one tidbit of advice is never let somebody tell you that you can't do anything. Like Dr. Frischkott mentioned, as a minority and as a female, there have been plenty of people who told me that, Sydney, you can't do this or you can't do that, or coaches that didn't support my dreams and thought I should only focus on athletics and not dentistry in my future career. So just stay the course. And if I had listened to those people, I wouldn't be where I am today. So just always keep your head up and know that you can do it and you will do it. And so excited for all of you future student doctors. So thank you.
Thank you so much. And Dr. Anamalachi?
I just had a quick note of one thing we may not have touched on is mental health. And so find some way to have some fun and enjoy the process. Many of us, we talked just, tip of the iceberg of the things that we've been through to get to where we are. But many of you probably have no clue as to what all the things we endured. And so think about your mental health as you're going through this process. Find some way to enjoy some of the things that you're going through, and remember to practice gratitude because of where you are and where you're going. And those things will continue to fall in place.
Thank you so much. And thank you so much. Dr. Hayes, do you have any words, or should I move on?
Keep the questions coming. Keep this engagement coming. Keep showing up to all the webinars. Keep doing it. Invite people.
Yes.
That's it.
Thank you all so much. Thank you so much to Dr. Hayes for being an amazing moderator. I really, really, really appreciate you all, because interestingly, as a lot of people have shared, there is really not that information out there about dental specialties. And this has been amazing because almost every single specialty was represented. We did not have pathology, radiology, or oral medicine, but the ones that usually bring up the most questions were represented. And I am really hoping that for those that participated and those that will watch this after, it kind of opens your eyes to the opportunities that are out there.